This week on Diabetes Connections, let's talk about summer camp. It is February, but signups for most diabetes summer camps are open now, and I know parents have a lot of questions. I'm talking to two camp directors, both with the American Diabetes Association, about keeping up with technology changes, misconceptions around diabetes camp, the top questions they get from parents, and lots more. If you're an adult with type 1, stick around and listen, because while a lot has changed with diabetes camp, a lot is exactly as you remember. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome, everybody. So glad to have you with us. I'm your host, Stacey Sims, and you know we aim to educate and inspire about diabetes with a focus on people who use insulin. Quick programming note before we jump in. There will not be an In the News episode this week. I'm heading to Mom's Night Out Cleveland, and because of the travel and the planning of the event, we're going to have a slightly different podcast release schedule. There still will be an episode coming out Friday, and it will be our 700th episode of Diabetes Connections. I wanted to give you a little taste of what happens at Mom's Night Out. So I'm going to be running our Ask Me Anything panel that we did in Philadelphia with Carrie Sparling and Ken Rodenheiser and me. And then we will resume our regular programming with a regular interview episode next Tuesday and then In the News on Friday. But yeah, Mom's Night Out Cleveland is this week. Registration has officially closed, but unofficially, if you're hearing about it somehow for the first time, let me know. Email me, Stacey@diabetes-connections.com. And we will always figure it out. If you've ever planned any kind of event, diabetes or not, I don't need to tell you that the week of the event is absolutely bananas, with some people canceling, some people waking up that morning and realizing that the event is going on. But it's always a lot of fun, and it always works out great. On to camp. Longtime listeners are very familiar with my family's camp story. My son was diagnosed with type 1 right before he turned 2, and he is now 20. And last year, 2024, was the first year since 2010 that I didn't have either kid at sleepaway camp. My daughter, who's a couple years older than Benny, she started going away to sleepaway camp in 2010, and Benny went to his first week of diabetes camp, sleepaway, in 2012. And then he went on to regular sleepaway camp, non-diabetes, and he worked there for 2 summers, including 10 weeks away in 2023 as a lifeguard. So it's pretty easy to guess from all that we love camp. We think it's an amazing thing, especially for kids with diabetes. And camp signups are happening now. We know you have questions, especially around technology. So much has changed since we first sent Benny off to Camp Carolina Trails. And even actually, that camp no longer goes by that name. It is now Camp Morris here in North Carolina. But I'm really talking about the changes to AID systems, right? Phone control, and a lot more. My guests this week are Emily Madison and Monica Montgomery, both camp directors for the American Diabetes Association. Emily Madison is a senior camp director for the ADA, currently living in Philadelphia, and she had been a camp director for YMCAs, the JCC of Long Beach, California. She has a master's of clinical mental health counseling and vocational rehabilitation. Monica Montgomery is a camp director in Rochester, New York, and she lives with type 1, grew up attending ADA's Camp Aspire, and she's worked there in a number of positions. She's worked in camp settings for 8 years, serving many populations. Now, as you listen, please keep in mind that we are talking specifically about American Diabetes Association camps. So everything here might not exactly apply to your local camp. But I think it will give you a really good idea of what goes on, and it will give you some perhaps good questions to bring to your camp. And I got to tell you, and I know I'm on the soapbox before we've even started here, but if you have questions or concerns about diabetes camp, bring them to the camp. Do not just put them on Facebook. There is great community support and there are great community answers, but every camp is slightly different, so don't make assumptions. Give the camp director a call or an email. Okay. My conversation about camp right after this. Benny has been using the Dexcom CGM for more than 10 years now. The first insertion was in 2013, just before he turned 9. It was great then. I mean, if you had done finger sticks for a while, you know how amazing it is to go from that to continuous glucose monitoring. But it's even better now. The Dexcom CGM systems just keep improving. They continue to get more and more accurate with no finger sticks or scanning required. The easy push-button insertion has made it easy for Benny to do it himself. He has done every one since we switched to the G6 in 2018, which was great for his independence back then as a younger teen. And of course, we still love the alerts and alarms and that we can set them how we want. Find out more, go to diabetes-connections.com and click on the Dexcom logo. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. Emily, Monica, welcome. I'm thrilled to talk to you. My listeners know I'm a huge fan of camp, so I appreciate you being here. Thanks for coming on the show.
Thanks. We're excited to be here.
Yeah. Okay. So before we jump in, let's just kind of introduce who you are a little bit more. Monica, tell me about your camp experience. You started shortly after your diagnosis, or was it a little bit longer?
Yeah, thank you. So I was diagnosed when I was 8 years old with type 1 diabetes, and I started attending camp either 9 or 10, so shortly after diagnosis. And it really, obviously changed the trajectory of my life because I'm still here working in camps today. And I love talking about my experience with diabetes camps. It really, gave me ownership of having diabetes and also kind of a sense of pride in the work that I did as a person with diabetes and still do as a person with diabetes. But really what camps gave me is a community. I still am very in touch with my diabetes camps communities. They're my best friends and my people. And aside from it just being the most fun and magical place ever, camp really just gives you, that community and that sense of pride in what you do.
Emily, I know you don't live with type 1, but how did you get involved in camp?
Yeah, I started going to camp when I was 12, and I like to say I've never left. And grew up going and then working at the same overnight camp, accumulated like 15 years, and then went to school to get a real person job, as I call it, as a therapist. But camp pulled me back, and it was my first love. And so I've been working full time in camping now for 8 years, and I've been with the ADA for over 2 years. And I can tell you, as a camping professional, that working specifically in diabetes camps has changed my life and my perspective on what camp can be. I knew it was an incredible place to, like Monica said, have community, make lifelong friends, gain independence, all those great skills. But truly seeing diabetes camps and being part of that community has made me realize the impact that camp can have on a child living with diabetes.
When I think about camp, I can't help but think of my childhood. Everybody in my family went to camp. Even my dad went to camp. Like, it was just a family tradition. And when my son was diagnosed with type 1, it wasn't one of the first thoughts. He was only 2. But it was in the back of my head because I was trying to think, how am I going to swing this? And my first thought was, once I found out about diabetes camps, was that I would just pick a different camp, a sleepaway camp every week, and send him around the country. He could do a tour. But we were lucky enough to find a great diabetes camp in North Carolina that prepared him. And then he was able to go to regular camp, which were longer sessions, because I spent my entire summers away at camp. I say all that to set up that my perspective on camp is different. My perspective was basically, he'll be fine. Put his clothes in the trunk. See you later, kid. Here's some stationery. And he went to diabetes sleepaway camp at age 7. So I think it's really important to get that out there because not every parent feels that way. And I want you to know that as you listen, where my bias comes from, which is go camp, full steam ahead and don't look back. But Monica, let me ask you, parents have so many different concerns these days. We're in the kind of sign up phase as this episode is airing. We're not in the go to camp phase. What should parents be thinking about right now?
Yeah, that's a really great question. And parents come with all sorts of questions and concerns about camp. I really think the most important thing to understand and to know about camp when you're thinking about registering your child is that we have a very extensive medical team at all of our camps. So all of our camps have endocrinologists, other physicians, nurse practitioners, nurses, CDCESs, dietitians. We very often have nursing students and medical students or programs coming through. Our ratio of medical staff to campers is big, and we have a lot of people there and a lot of experts, not just people who understand diabetes, but people who are experts in diabetes. And we also, Emily and I are on a team of almost 20 people now. We have a big team that works all year to get our protocols in place to keep your children safe at camp. Our camp committees, which are full of our, medical professionals, are also working all year to get protocols in place to make sure your kids are safe. So that's the most important thing to know, I think, is that we have people on site that is what they do, is they take care of kids with diabetes.
Emily, anything you want to add to that?
I have a question for you, Stacey, if that's okay.
Sure.
I think it's interesting you highlighted your bias and saying that, you were ready to send, or maybe you weren't ready to send your son off after his diagnosis and being 7 years old. Whereas now, living in an age of technology and constant monitoring, I think the feeling is very different. So for you, what do you think that perspective was as a parent, being like, okay, like my son's going off to camp, here he goes, and like, have fun, I'll see you at the end of the summer?
Well, I think because I had been away to summer camp, first of all, I do think that helped my perspective of knowing what happens. And it wasn't diabetes camp. I don't live with diabetes, but knowing that I'd had friends who'd, done everything from, a broken arm to a stomach virus. I had spent time at the camp infirmaries. That's where I found Agatha Christie books and just plowed through them, pretended to be sick a couple times so I could go read at the infirmary. I made great friends at camp. I had life adventures at camp. And I think it's really important for kids to have that time away from their parents and their school friends to see if there are other, this gets really deep, Emily, but to see if they are other people. It isn't always about diabetes. It's about independence. And for kids with type 1, especially younger kids, regular sleepaway camps are generally not equipped. So I wanted my son to have that experience that I had had, and my dad had had, my husband had had, and just really enjoyed it. Both of my kids, I have a daughter who's 3 years older than Benny. They're super independent. So I knew that they'd be ready to rock and roll as well. In terms of technology, when my son went to diabetes camp for the first time, he had had an insulin pump for 5 years at that time. There were no CGMs really at camp. This would have been 2011. So maybe 1 or 2 kids might have had one. But I felt confident that he would get skills at camp that he would need. And every adult with type 1 in my life had told me that it was a great place to get community. Long answer to your question, but we can talk. You can ask me any questions you want.
No, I love it. Thank you.
Yeah, and it's so interesting that you bring that up, Stacey, about the evolution of technology. So I tell parents all the time when we're talking about, monitoring and blood sugar testing and safety, that when I was at camp, we lined up on the testing bed in the morning, and that's what we did. And then we waited 3 hours to do it again. So, the type of questions and concerns that we get from parents has definitely evolved throughout the years, but it's always been the same bottom line, which is that I want my child to be safe and cared for. And you talk about independence, and that's really one of the most, if not the most important thing that camps gives kids, is that sense of independence, both in diabetes and in general. We see kids all the time that have those first moments, we like to call them, their first pump site on their leg, or their first time putting a CGM somewhere else, or their first finger prick without their parent. And those moments are really some of the most important moments that we see. And independence is how we get there. So
yeah, Benny did his first infusion set insertion on his own at camp. And everybody applauds at dinner, right? Every camp does it a little differently, but every diabetes camp has a way to go moment for these kids. Monica, we're going to circle back to technology and phones. But before we do, did you have one of those way to go moments when you were at camp?
Yeah, the first moment that I always think about is not really exactly a doing something for the first time moment at camp. It kind of happened afterwards. I went to camp shortly after I got on my first pump. And when I got the pump, I was very embarrassed to wear it out visibly. I wanted the sites to be covered. And the first moment that I set foot at camp on check-in day, everybody's buzzing and very excited. They're back at camp. I was, 9 years old, 10 years old. I just saw a whole bunch of insulin pumps and a whole bunch of sites. It wasn't really at camp, but it was afterwards when I went to school that following fall, and I wore it loud and proud on my hip with new stickers on it. That was a big moment for me. Just, feeling excited and not feeling ashamed to wear my technology for people to see. And I still do. Still wear it on my hip.
Okay. The biggest question I get asked about camp has changed since AID systems came.
Yeah.
The first question I used to get was, don't they just let them run high all the time? Isn't that bad for their health? Why would I send my kid to camp? I'm doing these questions out of order. I'll put a pin in. We're going to go back to that. We're going to go back to management. But the biggest question I get now is, my kid needs their phone to use their AID system. What happens to them at camp? And I will preface this again. I shouldn't say we anymore. My son is 20, but when he was younger, with the tandem system, you do not need that external controller. So this is a question that is technology dependent, but certainly Omnipod 5, I want to say the iLet, there are systems where you need an external controller, and often that is a cell phone. What do you guys do about that? Because cell phones at camp stink. I mean, let's be honest. Nobody really wants their kid to have a screen at camp. Right back to our conversation. But first, Diabetes Connections is brought to you by Omnipod. It used to be that you would have to choose between an automated insulin delivery system and the freedom of a tubeless device. Now, with Omnipod 5, you can have the best of both worlds all in one. Omnipod 5 adapts with every pod change to meet your unique insulin needs and adjusts insulin using a customized target glucose, not a range. If you're ready to ditch the multiple daily injections or send your tubed pump packing, there's never been a better time. They'll even check your insurance coverage for you. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com and click on the Omnipod logo. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections.
So that's a great question. And Stacey, that is also our most frequently asked question. It's regarding phones. And, I'm on a Mobi system. I only ever use my phone to bolus. It's attached to me all the time. And you're right that we don't want our kids to have phones at camps. And at any other camp, kids don't have phones on them. So what do we do about phones? We understand that they are an integral part of diabetes management. And our policy is that we want kids using the same technology at camp that they use at home. With that said, kids need to have their phones when they're dosing, when they're checking their blood sugar, and the rest of the time their phones need to be in range. Our campers at camp don't actually carry their phones, their counselors do. And we work very hard to set our policies in place so that we are in range as much as possible. And their phones are obviously taken out when they feel high or low, if we have alarms, and when they need to dose.
Maybe I should have started with this question, but knowing that not every diabetes camp is an ADA camp, do all ADA camps follow those same guidelines?
Yep, all ADA camps follow these guidelines. Our cell phone policies, and they are changing. Technology is so rapidly changing that we kind of adjust these policies every year. We just had our medical directors conference back in November with all our MDs at all of our camps, and this is what we're talking about. So we make adjustments as technology adjusts, and we talk about what works and what doesn't. But that is, yes, the policy that all ADA camps follow.
It's funny you said, technology evolves. I said tandem, you don't need a cell phone. I'm obviously talking about the T-Slim X2. The Mobi, you do need a cell phone, which shows that but I'm not on top of the technology anymore with my son. It's funny.
Yeah, and even with the X2, so many kids use the T-Connect app now. And again, we want them using the technology at camp that they use at home. So even a lot of our campers on T-Slim will use their phones. And of course, for Dexcom.
Have you had issues with campers or parents wanting the phone on the child at all times? And I'm going to give this one to Emily, unless you wouldn't really want Monica to answer it.
We do. And, I have a lot of empathy for those parents because I'm not a parent and I don't have a child living with type 1. But I can't imagine being in that caretaker role and then suddenly you're giving your most prized possession over to a bunch of strangers that you don't know. Yeah, Monica and I will get those phone calls, whether they be 12 p.m. or 2 a.m., asking what their child's blood sugar is. And, it's our responsibility to make sure that they understand that their child is being taken care of by the amount of medical professionals that we have in sight is probably more than they will ever be around at one time. Again, yes, and we do our best at all times, and I also understand how frightening that can be. And I say camp is not just independence for kids, but also a learning experience for parents too.
When you allow those kids to have their cell phones nearby, are you turning off any kind of follow app? Is that it's pretty standard, Monica?
Yeah, that's our next most frequently asked question. So we strongly discourage parents from following their campers' CGM data or pump data from home. We will not turn it off unless the parent requests that, but we do discourage it, and that's for a number of reasons. One being that we have across all of our camps very different signal, Wi Fi, things like that. So it's very common that if a parent is following from home, what they are seeing might have happened 15, 20 minutes ago. So that's one reason. It's also just to foster independence, right? For the child, we want them to have those like aha moments, those I did this on my own moments. And we also, for, the parents, we want them to be able to have a break. I think about my parents, and I'm sure, Stacey, that you experienced this with your son before CGMs were popular. When they dropped me off at camp, they were able to have this week where they just like took a breath and slept through the night. And I think that was so important for them. We want other parents to have that too.
Just to clarify, you said that you don't turn it off unless the parents request it. Did I hear that right?
Yeah. So
Because I thought it would be the other way around. You turn it off unless they request the case stays on.
Yeah, it's something that
sorry, go ahead, Emily.
Go ahead,
No, I was
Emily.
gonna say it's something again like weaved internally, not to like peek behind the curtains, but again, it's like these discussions we have with our medical directors and medical team about, what is the best way to move forward. And I'd say like 2 years ago, we were like, yeah, we are gonna turn this off for everyone. And then coming into 2024, 2025, we were like, it's really difficult to ask every parent to do that. And it takes a ton of time on our end to do that during check-in as well. And we were like, okay, this is a learning experience for everyone. So we will strongly discourage. And again, I think most families do tend to disconnect, but we're not going to force someone to not be able to see their child's blood sugar.
And I'll add with no actual data at all. This is just anecdotally what I've seen is after year 2, parents want to disconnect. Sometimes it takes a couple years for them to build that trust. But with our teenage campers who have been coming to camp, their parents are like, turn it off. I don't want to see, take them. And we understand that it might take a year or two to build that trust. And we want parents to figure that out in their own way. But we definitely see that our older kids or kids who have been coming to camp for a little bit, their parents are much quicker to disconnect.
Yeah, I'm glad to hear that. I'm glad to hear that because it is difficult, especially, I imagine if when my son was diagnosed, we were handed a CGM and share and follow immediately, I wouldn't want to disconnect, especially that first year at camp. It's a very different experience than somebody like us diagnosed and did finger sticks for forever and you never saw the numbers in between. And you never saw the numbers when they were at school. You never saw the numbers when they were down the street. Very different experience. Let's go back and talk about that management question, because I believe that is a big fear of many parents. Won't camp run them high? And I can say that wasn't my experience, but it does vary. Monica, let me start with you. What do you tell parents?
Yeah, so this is again a question that we get often. So the short answer is no, we're not going to run them high. What we explain to parents, and we really want them to understand this, is that our number one goal at camp is camper safety. We understand we want, of course, to have the best time and range possible at camp. And I also want to sidebar with a reminder that Emily and I are not medical professionals, and our medical directors could probably speak to this much better than we do, which is why we put them on the stage during parent orientations. We want the best time and range possible, but sometimes we do let up on insulin a little bit, depending on the activities, depending on, what they're eating. So it's important to understand that when we come to camp, our lives completely change. Our routine is gone. Kids are so much more active at camp with us than they are at home. So no, we're not going to let kids run high. We're not going to completely let them run at a dangerous level. We will, however, adjust per child depending on activities and food and things like that.
I wonder how much this is a throwback to pre-CGM days, Because let's face it, before CGM, it was safer. Like, oh, you're going in the pool? We're going to have more uncovered carbs. Or, we're going to do one finger stick overnight. So we're going to, and I'm not even talking about camp. I'm talking about in my house, right? So we're going to go to bed a little higher because we had a very active day. So having a CGM for the family makes it easier to have more time in range, I'll say. I imagine it's the same situation at camp. You've both been in camps since the advent of CGM. Am I kind of on the right track there, Monica?
Yeah. So this is a hard question for us to answer again because we're not medical professionals. So at the end of the day, Emily and I are not the people that make these decisions. So our medical directors at camp are the ultimate deciders. They're usually pediatric endocrinologists or providers that work in endocrinology. So really, they're the people that are deciding this. Again, they understand the importance of time and range. And yes, this has changed since CGM. They don't need to be 150 to get in the pool necessarily. So yeah, I think in general, it's a hard question for us to answer without being medical professionals and without being the people that make these decisions at camp.
Fair. Go ahead, Emily. Did you want to say something?
To me, it's all about, and Monica's helped me understand this too, it's all about education and the way that things are communicated. So, I always say Dr. Nicole Sheenan is a pediatric endocrinologist at Cincinnati Children's, and I've seen her explain to parents during check-in, it's the summer and your child has been sitting on the couch for weeks. And so they're about to go into a mode where they are literally on their feet for 12 plus hours of the day. So their body is adjusting. The AID system has to adjust to this, and we are doing our best to mitigate all of that. And watching her sit there and explain that to not every single parent, but a lot of them to make sure that they understand has really helped me. And with my knowledge and just as a camp director as well, understand, okay, if a parent asks, is my child going to run high all week? The answer is probably no, like Monica said. And we're going to tell you why. We're going to tell you why numbers might look different than they do at home, at school, or whatever activity you're at.
I just want to add quickly, too, that it's important to note that we don't take a one-size-fits-all approach at camp. We do have general policies that we follow depending on what's going on, but the reason we have so many dedicated medical staff is because every child's diabetes is different and it's treated differently at camp. So it's never a one-size-fits-all approach. Every child is treated, their diabetes is treated how it needs to be treated, and that's the choice of the medical professionals.
Yeah. Again, I'm sorry to keep talking about our experience, but
please.
When we used to drop Benny off at camp, his camp, it took forever. I mean, check-in was ridiculous because, and no one complained, because they would take their time with every individual child. Of course, people complained. I'm sure I complained at one point. But they would sit with you, and a medical professional would sit with your child, look at all the settings, and Benny always had his insulin rate cut by at least 25%. This is, again, before AID system, so it's a little different. And he always was well in range at diabetes camp because he was so active. It actually really helped us get ready for regular sleepaway camp. I was always so happy to have diabetes camp first because we would look at those pump settings and be like, all right, we're going to drop it even further now because you're going to this other camp. Let me ask about food. Talk to me a little bit about how you talk to parents about what their kids are eating at camp.
Stacey, you don't love camp food? No. No, and I think camp food gets a bad rap for that reason. And truthfully, in 2025, I feel like camps, the host sites that we use, because as the ADA, we do not own the sites of our camps, they do a great job in working with us and our dietitians to really build out a comprehensive meal plan that gives us the appropriate amount of carbs and protein and things that our campers and our staff need to get through the day. So whether that's your typical chicken or hamburgers, hot dogs, whatever that looks like at camp, you're probably going to have it there. Do we have a lot of food allergies, gluten-free and other dietary restrictions? Absolutely. These camps are used to accommodating. So we do get asked about it a lot, or a parent will say, my kid's a picky eater, or there are other options out there. And yes, camps have salad bars that will usually have other alternative things because they're used to having kids eat at their campsites. And so again, I think it's slightly less of a struggle now, but there are parents who come to us with a little more specialized diets, and, camps, we can't accommodate all of that. But for the most part, I'd say food has become less scary and less of that stereotype of, oh, this is camp food.
Yeah. Do you all use CampViews or Camp Review at any of your camps? And I should explain real quick. We did an episode on this a while back. I'll link it up. This is the system where a camp or anybody really who's using the system can see multiple, many campers or users, CGM readings all in one place. Oh, Monica, tell me about that.
We do. And sorry, Monica, I didn't mean to.
Oh, Emily, jump in. Yeah, go for it.
Yeah. We started using CampViews back in, I want to say 2021, 2022, at just a couple of test sites with some of our biggest camps. And we have an incredible relationship with them where we don't have them at all of our camps because sometimes it's just either not necessary at a day camp or the technology doesn't allow us to use it at that site. But I would say, I think we're at almost half of our camps they call it Views EMR. Now they've morphed their name a little bit over the years. We work closely with Sarah and Nate, who are the owners of Views EMR, to incorporate their program into our camp setting. And it's been a game changer in a lot of ways. And I mean that in a positive and like not a negative way, but just an interesting way, I think. Again, to have access to numbers at all times. People will react a certain way if they see, a kid turns red, if they go below 70, and the immediate reaction, if you're watching that screen, is to, oh my gosh, I got to go, got to go run over. Did the counselor handle it? Oh my gosh, we got to handle this immediately.
That's
okay.
Someone jumping on a golf cart.
Yes, immediate golf. Yeah, some want to respond right away. So again, it's a great tool to have, and I think a really good learning experience for a lot of our counselors and medical staff to use.
Yeah, and to give a little bit of background for people who might not know, Views EMR is an electronic medical record system that we use at some of our camps. If it's used at that camp, we will use it to record every child's blood sugar and medicine. If they take long-acting insulin, we record that. So everything's recorded there. It has the capabilities to connect with every camper's Dexcom who uses a Dexcom if they use a cellular device to access their Dexcom data. So this has been a great help for us. It's a great tool, but we also really want parents to understand that we have been monitoring blood sugars with CGMs, without CGMs, without CampViews or Views EMR forever. And so even if your child doesn't use a cellular device to access their CGM data, we will still make sure that they are monitored very closely and they will still be recorded in the EMR system if the camp uses that system.
Great. So, Monica, you said you started going to camp 9 or 10 years old. Do you remember, what was your favorite part about diabetes camp?
Oh, that's such a hard question. I don't know. I loved all of it. And it's so interesting because so much of what I loved about camp as a kid doesn't directly relate to diabetes. I think it was my friends that I made at camp, but we were able to connect so quickly and so closely because of our shared experience. But I loved camp songs. And I strangely loved the dining hall. And I loved lining up to test our blood sugar before we went into the dining hall when we were young. And I think it's because it's that in-between time with your fellow campers and with your friends where you really get those goofy, silly bonding moments. So that seems like a silly answer, but that's what I loved so much. And when I think about my experience at camp, those are the moments that I think about, those in-between moments, just kind of goofing around with my friends when we were getting ready to take insulin or test our blood sugar.
Where did you go to camp?
So I went to camp here in upstate New York in Rochester at Camp Aspire, which is an 88 camp. And that is still one of the camps that I run to this day, which is really, really fun. Some of my best friends in my life are people that I met there. My husband is someone that I met there. He also lives with type 1. So really, it's where I built my community, and I have a lot of love there.
That's great. Emily, I know you didn't go to diabetes camp, but you've worked in it long enough. What do you like about it?
Great question, Stacey. I'll share a story that happened from my first summer as director at 88 Camp Correlates in Ohio, and everyone was in the dining hall sharing they were sharing their firsts, and I forget how it came up, but someone was was asking me, Emily, do you live with diabetes? And I said, oh, no, I don't, yada, yada. And then all of a sudden, the entire dining hall just started chanting Muggle. And I was like, what is happening? And for those who don't know, Muggle means you're not a wizard in Harry Potter world. So all of a sudden I was looking around, every kid and every every staff member is chanting Muggle at me. And it's like 200 plus people. And I was like, what is going on? But they were absolutely loving it. And to be part of that, like, it wasn't about me. It was like I was the odd one out in that space. And that's when it kind of clicked with me. I was like, this is one of the most special things that I will ever be a part of. And I will also never completely understand as someone who doesn't live with diabetes. But to be a part of that community again, where it's like Monica was saying earlier, like, this is the norm. You walk and you see CGMs, you see sites, you see pumps out. This is diabetes camp. So to have Muggle chanted at me was a special thing. And just really showed, the beauty of diabetes camp and community and connection.
I love it. That's so funny. As we are taping this, registration is soon to open. As you are listening, registration is likely open. Other than, we'll link up all the information where you can find a camp near you. But any tips and tricks? I mean, my tip and trick is do it immediately because camp does fill up. And, I know that there's a deposit and maybe you're not sure. And is your kid ready? Immediately register and then figure it out between now and camp. Any other tips and tricks?
Yes, definitely. Two really important things about registration. The first being that we do have financial assistance available. It is our mission that no child does not have access to camp for financial reasons. So please go on and apply, and you can apply for our financial aid. The other thing that I will say about registration is please be patient with it. It can be a long process. We ask a lot of questions about your child's health and what they like and their diabetes. So maybe set aside an hour to do registration so that we can have all the information about your child that we need.
Registration opens at 12 p.m. Eastern on February 12th. Some camps do sell out. So it is important to get on there and make sure that you have your info ready. Like Monica said, it is a lengthy process, but it's worth the time and effort to get on there.
So this is a tough one because let's face it, like there are kids, there are families sometimes that just don't sync up with camp. It's not for them. What do you tell parents if they've never been and they're afraid, like, this is not going to work for my family? I'm afraid to send my kid, not because they're afraid of their medical condition or they're afraid of the safety, but because they're worried that they just won't like it.
Yeah, that's a great question. I would say to parents who have that reservation, talk to a camp director. Find the camp closest to you and, email that camp director. All the information is online. We love talking to parents. It's what we do a lot of, from now until May. We'll be spending a lot of time on the phone with parents and just ask us questions about camp. Tell us about your child, and we will have a conversation about whether we think camp will be a good fit for your child. And we're also always excited and happy to try. So we love to talk about how we can make them feel safe and comfortable at camp, and just, have a conversation with us, and we'll tell you about camp and you'll tell us about your child and we'll talk about it.
Yeah, I was going to say communication is the number one most important thing. If you're able to express your fears and worries and maybe your child's fears and worries, and us being able to respond or just get out as much information as we can so your child is set up for success, that's what we want to do as camp professionals.
I would also add, and you guys can't say this, so I'll say it for you. The people that work at these camps are there because they love camp. And they love the kids, they love the activities, they love the atmosphere, and they want to make it great for these kids. Nobody's doing it to get rich. Half the time they're not paid, I'm sure. We don't have to go into all that, but they want to make it wonderful for your kids. And I can't tell you how many times in my local group, we have parents who are so nervous and then they go to pick up their kids. The kid has literally made a sign, and I can post this picture that says, "Do not pick me up. I now live at camp." Like, do not come get me. I live here now. Go home. And I do think it's so worth it. I mean, we just had an amazing experience at all the camps. I think it really helped my son in so many ways. Emily, Monica, thank you so much for spending so much time with me. I appreciate it. I hope people are not afraid to ask you all of those questions. And I really hope it's a fabulous season for you guys. Thanks for being here.
Thank you, Stacey, and thank you for advocating for camp.
More information about the American Diabetes Association camps and their programs over at diabetes-connections.com. As I said at the very beginning, not every camp is an American Diabetes Association camp, so not everything you heard here applies to every camp. Please check in with your individual program to find out more. I will link up some of the episodes that we have done previously on camp. Benny's talked about it once or twice. I do not think it's an exaggeration to say that camp has been an essential part of my family's experience. Diabetes and regular sleepaway camp has shaped Benny in amazing ways, given him opportunities, let him make mistakes in safe areas, given me a chance to grow as a mom and figure out who I am as a person when I am not with my children. Again, diabetes or not. It has made the transition to college easier for both children in ways that I kind of knew would happen, but I just did not expect. It's really a night and day difference if your kid has never been away from home. So feel free to reach out to me as well. And you can post in the Facebook group or email me directly. I'm more than happy, obviously, to talk about camp till the cows come home. Remember, special episode this Friday instead of In the News, which we are moving to the following week. Hello in advance to everybody at Mom's Night Out Cleveland. I cannot wait to meet you. It's going to be so much fun. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions, and congratulations to him, his beloved Philadelphia Eagles, and the Super Bowl. Really appreciate you, John, and very happy for you. And thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.